Three, two, one, and it's here we go. We are live. It is 6 o'clock now. It's end of January and Wednesday, and yeah, TikTok Live number 46. I currently have the flu. I was out today. Yeah, I probably shouldn't have gone in yesterday either. Oh my god, I was so sick, and today I felt a lot worse. Right now, as of like an hour ago, I just stopped. I just stopped sneezing out of nowhere. I'm like, I've been coughing a lot less. Anyway, top 3 listeners, TikTok Live 46. I'll be giving you guys a shout out in the caption. And first comment just put in here. FirstDownDental said, "Hey Doc, hope all is well, my man. Love the content. Thanks, friend. Thanks, dude. Good to hear from you. Hope you're doing well. Just gave me a number 1 gift your badge. Thanks, FirstDownDental. I hope you're doing well too. I hope everything's going well. Gosh, this flu that's going around. What was it? 3-4 weeks ago. I had about 4 weeks ago I had a stomach bug. I was throwing up for about 6 hours. It was horrible, chills, everything. The next day, like fine. Well, actually, no, I'm sorry. It wasn't. I had stomach issues for about a week. Okay, but it was one night, just bang. And now I got this flu. It's this head cold. It's like congestion, runny nose, massive headache. Like it feels like your head's about to explode, like right in the front here. Coughing up a lung the last 2 days. And it started last Friday. Today's Wednesday. I thought I might have felt it coming on last Friday because I just started to randomly sneeze, like more. If I sneeze more than once in a day, like that's very unusual. So that's how I knew something was coming on. So I got the flu, everyone. Luckily, you can't get it, right? Oh, all right, let's get after it. Tick 46. Next comment in here is KDS 2107, the flu. Yeah, man, the flu. It's been horrible, but I just, what is it, like 3 hours ago, I took some more Dayquil. So I'm still in that like 4 to 6 hour range where you're feeling okay. It's around like 3 o'clock, so it's been 3 hours. Hello, how Rua said, besides surgery, what dental specialty makes most money, associate, and business? You know, it's tough because you don't really want to get into just strictly the finances behind dentistry when it's about patient care. It's about patients being at the center of focus. But maybe general dentistry, you know, you see a lot of ownership of general dentists employing other dentists, maybe getting a couple specialists under their roof some days a week, and there's a significant way to make some money behind that. If I didn't go oral surgery, I probably would have gone general dentistry. Periodontist is interesting, but then now you're just you're getting into a more surgical specialty of dentistry as a periodontist, but you're not capable. You don't have the full understanding of doing all the complications that can come up with these bigger surgical procedures. Exposing bonds, like, what are you going to do if you hit one of those arteries in the palate? What do you do? Like, have you done that before? Have you managed that complication before? Have you taken call where you're managing infections? I've taken a ton of periodontist infections myself in the ED, managing those infections. Of any dentist, it's not just a periodontist, right? It's of any dentist. But then, you know, now you're going into a surgical area where complications do occur, and you're not the one managing them. I think the thing is, you need to know how to manage complications before you're going to take that next step, doing larger surgical procedures. This is just my personal opinion. Okay. So, Fern, do you think the Commanders can beat the Eagles on Sunday? Jesus Christ, Fern, is it the Super Bowl already? Wow. It is the Super Bowl, isn't it? Wait, I thought that was in February. I thought it was a couple weeks. I'm way off, guys. Fantasy football ended weeks ago. I did get second place, which is pretty awesome. I made $50 on it. It was $50 entrance fee, and I got back 100, so I made $50. That was pretty cool. Second place. I've never even played football, but we had a league of like 12 dudes that like most of them played football, which I don't know. I thought that was pretty cool, but I don't know. I'm on call this week, and I got to see what's going on. I got a busy weekend ahead, but I don't know if they could beat the Eagles. R_Bellerin, tips for someone who want to get into running. What type is the best? What do you mean what type of running is the best? You just got to start. Whether it's a treadmill, outside, the stairs, you just got to start. And what you need to constantly think about is, how can I enjoy this a little more? Personally, for me, on the treadmill, I play with the incline. I play with the speeds. So every 10th of a mile, I'm switching up the speed. I'm going up, I'm going down. I do a certain run where I do a half a mile warm up, and then the half a mile to a mile and a half, so 1 more mile. I'm doing incline intervals. Every 10th of a mile, I'm going up to 12, down to 4. I always keep it on 4 incline. From 4 to 12, 4 to 12, I keep it steady at a pace of 7, speed of 7, okay? And then I take another half mile break, and then 2 miles to 3 miles, I do speed intervals. So I go from 7, I hit a 10th of a mile, I go to 8. After another 10th of a mile, I come down to 7, 8, 7, 8 for a full mile. After I get to 3 miles, then I do like a half a mile cool down to about 3.5 miles. When I run outside, I try and get, you can't control that incline. So you can't control how much calories you burn. I try and get about 4 miles in when I'm running outside. So that's my little running workout. Figure out what works for you, because then that makes it much more enjoyable, right? Don't do that. And that's hard. That's a really hard incline workout. But see what you find enjoyable, because running should be some way for you to find some escapism, some happiness, some excitement in it, and to find find a fun way to burn calories. Okay, that's what I'm getting to. She said, I've had the flu on and off for 2 weeks. So we're on and off? Wait, so it went off and then came back on? What happened? What did you do to make it come back on? I don't want that. What's going on? How did that happen, Chi? Troy Feller said, any advice for incoming D1 students? Yeah. Incoming D1 student in dental school, enjoy the summer. Finish up your year, whether you're out of school or in school. Just enjoy the rest of this year, because it's going to get busy starting D1. Don't try and study something over the summer. No, travel, visit friends and family, because you're not going to be seeing them as much during school. And just do your thing, man. Enjoy your life right now. That's. I know it seems cliche. That's actually really important. And when you get into dental school, you're going to be like, Jesus, I should have done what he said. Next, FirstDownDental, what's your opinion on the Dave Ramsey approach to student loans, looking at a travel job in Alaska? Can you remind me what the Dave Ramsey approach is? I have seen his videos here and there. I haven't seen one in a while. Just remind me of what's his approach again? You're looking at a travel job in Alaska. That's awesome. Alaska's beautiful. I haven't been there, but I keep hearing excellent things between the land, between fishing and just quality of life up there. I'm hearing is great, except for that that time of year where it's, what is it, like 5 hours of sunlight or something? Isn't it like right now? If you're in Alaska, right? I remember I had someone alive a year ago, and it was right this time of year, and it was like 5 hours of sunlight a day. That's gotta suck, AD said, what you take to stop the cough? Well, I still do have the cough. What I take, I have it right over here. I should have made a video on this. I've been ripping the emergencies all day. I mix it in some water. I eat about 3 zinc tablets a day, like morning, noon, night, right around meals. So the zinc tablets and the emergency vitamin C, and then zinc ionophores. Those are some other tablets to get some added zinc on top of the regular zinc pills. Make sure you're covering all the bases there. I really just think vitamin C and zinc, for me personally, is the best for your immune system. And then making sure you're keeping, your electrolytes are up too, like with Pedialyte or something. I haven't been taking Pedialyte because I haven't been throwing up. New York Bua said, how long have you been a doctor? Well, I graduated from dental school 3.5 years ago already. And in 4 or 5 months, I graduated from oral surgery residency. So I've been it for 3.5 years, and then I'll be an official surgeon starting in like 5 months or so. Hunter Kiesling said, what do you think about, where'd Hunter Kiesling go? Hunter Kiesling, come back. Where'd it go? Wait. Hunter Kiesling, what do you think about the HPSP program for dental students? I forget what the HPSP program is. Is that the Army or Navy group? Hunter, remind me what you mean by that. Joy, do you recommend taking a gap year before starting residency? Residency is different. So I definitely recommend a gap year in between college and dental school or medical school, for example. Really get out there. Travel, work as many jobs as you can get, learn as much as you can, try as many new things as you possibly can, because I think that's where you get an idea of where you fit in this big, vast world where opportunities are really endless. But what opportunity are you most excited and motivated to embark on? You know what I mean? And then to make a career out of that could be 30 plus years. I think that's the most important thing. And you really need that time for yourself. You really do. You really, really do. But before residency, I don't know if I would recommend taking a gap year before residency, because, the longer you delay your residency training from dental school, that's just, you really kind of just want it to pick up itself. It's different if you're taking a gap year between college and dental school, because it's like, it's real life experience you're going to get. You're going to get to see the real world in that gap year. In between dental school and residency, you might not be working on your hand skills unless you're working as a general dentist, perhaps. But in some states, you need a residency to work, such as New York. Right? You wouldn't be able to graduate dental school in New York and then work right away. So taking a gap year could affect you in that way. Lee said, how does OMFS work? Sure. Well, OMFS is oral maxillofacial surgery. And how does it work? You do 4 years of dental school, and then you do a residency that's either 4 or 6 years. There's a 6-year one that spends those extra 2 years in medical school. So you get your MD, and that could be a really important degree. There's no difference between either oral surgeons, though. Whether you have your MD or not, when you graduate oral surgery residency, we all do the same oral surgery, okay? The MD could be considered beneficial, maybe, if you want to go on to a fellowship training in head and neck, cancer, or like a plastic surgery fellowship or stuff to learn about other types, like breast implants, you could do that. But most oral surgeons, like 99%, just end up doing the classic oral surgery stuff, jaw, face stuff, trauma, orthognathics. Like 99% just do what oral surgeons do and don't do that extra fellowship. I'm not going to do a fellowship, right? Power GD6 said, hi, sir. How long do I have to wait to eat after having a root canal? I would ask your endodontist for that. I think it's going to depend on if they have any temporary fillings, if they temporize the tooth at all. I also don't know how long it's been. So I really can't give you an exact answer. If you just had this root canal done a couple hours ago and you're still numb on that side, I don't know if I'd recommend eating just yet. You're going to bite right through your lip. So it's really up to them as far as that goes after your root canal procedure. Joy said, I start my first semester of dental school at NYU in the summer. Any recommendations? Congrats. Yeah, you got to study hard. I would recommend, I feel a sneeze coming on. It's that flu that I got. Got to get a TikTok live in, right? Right, friends? Make a good podcast episode. By the way, I am recording this for the podcast. The top 3 listeners who listen to the entire episode, I'll be giving you guys a shout out in the caption of TikTok live and YouTube. But yeah, excuse me. I apologize for coughing and my congestion and sneezing throughout this. But yeah, a couple days of the flu now. So you're starting your semester at NYU Dental School. Congrats, by the way. My recommendations would just enjoy your time now. When you do start, focus on how you can figure out your own personalized, efficient, and effective studying. The double E's. Effective studying is getting higher scores. This is obvious, I know. Getting C's, B's, A's, these 95s. But efficient studying is what I want you to focus on for dental school, okay? How can you maintain those A's, 90s, 95s, but study less for them? Does that make sense? I figured that out by using Quizlet. I bought the premium version of Quizlet. I just repped those Quizlet cards out. I had a figure to all the terms. This is how I studied for the boards 2 weeks ago. I use Quizlet. I'm studying for the OM-site in 3 weeks, 2 weeks, 3 weeks. 3 weeks, 3 weeks, using Quizlet as well. Quizlet's my key, okay? You want to try and study, you're studying 10 hours for that exam. Get it down to 6, 5, 4, and still maintain those A's, okay? That's efficient studying. Efficient and effective studying is so important, okay? You need to work on that, Joy. King of Arabs asked, I'm not a U.S. dentist. I'm going to do a 2-year program and become a dentist in the U.S. Can I still do OMFS? Maybe. It's going to depend on the program. It's going to depend on your citizenship status. I'm not entirely sure about that. You'll be able to look into it when you're here, though. Okay, do it. JTBC_8. Joy Bros, start reviewing everything you learned for the DAT bootcamp. You'll need to know them again. That's not necessarily true. That's actually not true. So I wouldn't recommend doing that. I wouldn't. Michael Schuler, fluoride or not? Fluoride's interesting because it's shown, if it's consumed, it's shown to have some deleterious and negative effects on the body systemically. It could affect your neurostatus. It could affect apparently it could affect the central nervous system, right? Among some other things. Like I'm hearing that it can affect your IQ. Maybe. The fact is it being consumed? Because in your toothpaste, the number one factor that cleans your teeth is the fluoride. But you're not eating your toothpaste, right? You want to make sure you spit that don't eat your toothpaste. Spit that out, right? It's good to wash and clean your teeth with fluoride and fluoridated toothpaste, but maybe not necessarily to consume it, okay? That's the difference. And I think a lot of people are getting caught up where it's like one or the other. No. Just don't swallow your toothpaste, okay? Alex23, should I ignore research if I'm a DA, dental assistant with 3,600 hours of experience? I'm from Florida trying to go to Nova. Do it, dude. I don't know about ignore. I think the answer is always to try and get both in. You know what I mean? You don't want to just do one or the other because then it might not look good. But if you could get both in, that's going to look extremely good, okay? Do you necessarily need research to get into dental school? You don't necessarily, but yeah, something to consider. My fiddle leaf is starting to lose leaves. Good light, enough water. What am I doing wrong? I don't know what a fiddle leaf is. I don't know. I got 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 plants in my apartment. I'm super proud of that. I'm a plant guy. I'm a plant dad, if you will. Yeah. I don't know. I love plants. I don't know. I would try all those things you said in a circle and see what, try one each. But I hope it stops losing leaves, friend. Shay said, keep up the great content. Thanks, Shay. You too, man. Good to see you, Shay. Laura V followed the live creator. Thanks, Laura. XSR_Bellarine. Thank you. You got it. From King of Arab said, not a U.S. Senator, but go to 2-year program. Can I still become OMFS? Yep, I answered that one. I hope you can. I hope you can do it. Basir Khan, I'm a D1, but not sure if I want to do OS. Basir Khan said, I'm a D1, not sure if I want to do OS. Well, get some exposure to a variety of specialties. Make sure you get exposed to oral surgery. You might not know. Try assisting, try observing, try helping out where you can in different clinics. Try all the clinics that you might have some interest in. And you'll know over time. And if you don't know, you got to keep going. Keep getting exposed to it until you do wake up one day. You have that thought, that light bulb goes off, and you're going to know what is right for you. And it might not be specializing, it might be GP, and that's great. You want to know what you're excited to be doing for your potentially 30 plus year career, plus or minus year career. Mia G said, why does wife's cap keep coming off? Cap? Wife's cap? What's cap? What's the cap? I don't know what you mean. Excuse me, Basir Khan, because of super GPs taking over market, such as implants and such. Yeah, it's an interesting thing. It's a very interesting thing, and it's because it's very hard to run an operatory on I don't even know if you could run it off of preventative care. Everyone seems to need a crown or a filling these days. I think we really need to reverse engineer these insurance companies to make sure you can make a comfortable living on preventative care. Like, none of your patients have cavities. You're probably doing a good job, and you shouldn't need to live subpar or barely be able to keep your lights on in your office because the insurance company isn't reimbursing you for those things. They should. If you're doing a really good job, keeping patients coming in every 6 months or so for cleanings, no one gets a cavity, everyone's doing great, I think you're doing a good job personally, and I think insurance should reimburse for that. You should be able to live comfortably off preventative care. I'm not going to stop saying that. FirstDownDental, pay off heavily and then live frugally for 6 to 8 years, basically pay back massive increments. Yeah, so that's his way. I think it makes sense. I don't know just yet. My cousins did that. They're lawyers, and they paid their debts off right away, and then they lived comfortably. They lived within their means until they could build up their law practice and such with kids, and they did it very well. I'm going to try and work on that. I think I would do the same thing if I was to end up being in that situation. FirstDownDental finance interest rates currently at 9.08, which is terrifying. Oh, wow. I don't know what that means. I haven't looked into that enough with the refinance interest rates and such. So I'm not the best person to ask about that. Omi Nunu asked, will green tea help with cough? Potentially. I know that there are some tea, maybe ginger. I know there are some teas that are very good for coughs and such, and being sick and the flu. Maybe green tea. Remember, green tea has a little bit of caffeine in it, though, so you might not want to take it late at night. Josie R71990 asked, where'd it go? Wait. Josie R71990 asked, had a wisdom tooth extracted, and I'm now on day 5 post-op, and the stitches are coming out. Is this okay? Yes. Generally, this is okay. Now, I don't know what stitches they put in, but generally after extractions where we need to, incise the gingiva, make a little cut with a scalpel in the gingiva, we reapproximate it, which is what we put the gums back together with a stitch called chromic gut. It's a stitch that dissolves, comes out usually between like 7 and 10 days. But if it's at day 5, that should be okay too. Okay, now I'm not giving medical advice. I'm just saying generally what the consensus is. I can't give medical advice through social media and whatnot, but that sounds generally reasonable to me for a timeline of stitches coming out. That's not too far off between the 7 to 10 day chromic gut, like dissolving, Excuse me. Luke, incoming D1, do you have any suggestions? What's up, Luke? What's going on, man? Do you have any Luke, where are you going, by the way? I'm sure I asked you this on the last TikTok live. My head's a little loopy that I have the flu right now. But yeah, Luke, where are you going next year? Do you have a Luke asked, do you have a suggested timeline for the specific CBSE resources mentioned in your podcast episode? I would give yourself like 3 to 5 months, depending on how well you study for it. 3 to 5 months of studying via those methods. I would definitely give that, 3 to 5 months out from the exam, maybe plan 5 months out from the exam, and then you really ramp into it after like 2 months. So then 3 months out, you're really hitting it hardcore. All those resources on think of 3 to 5 months out as your timeline, okay? And think of how much time you're going to have. If you're going to have to study for it on top of dental school, I would look at 5 months out. If you're going to have a big chunk of time, like during the summer or something, after like D2 year, then do it like 3 months out. In the summer, okay? Luke said, like, what a D1 could start out with versus D2, then D3. Yeah, so It depends on how much time off you have, right? If you get less time off, you're doing this on top of school, maybe start like 5 months out. If you have that time off and you have a couple months off and you have a whole days and weeks to study for, then maybe 3. Okay. Just my thoughts. Thank you underscore I love you said, if you only had access to one burr, what are you choosing? Well, for a crown prep, I would probably go with the 550. If I was to do going for like extracting a wisdom tooth, maybe just like the straight fissure, I would just rip through that. I would section that tooth and get those pieces out. That's what I would do. Buckle trough, the fissure burr should be just fine. Hunter Kiesling, yes, Army and Navy. They will pay full dental school tuition plus stipend while in school. I mean, that sounds excellent. Plus a stipend while in school. How could you say no to that? Wow. I mean, that does sound excellent to me personally. I don't know what else you have to do for them though, and if that's worth it. That's also the tuition though these days, and I don't see it going down anytime soon. Because remember, the incentive right now for dental schools among all colleges and such, they're making more money off the students than off like the careers that the students are going into. Like endowments and reimbursements from people who graduated and became successful and have the money to give back. They're just outright making money from students these days. Dental school specifically, they're making more money off students than off patient care. And I know what you're going to say. Well, we shouldn't be making money off patient care anyway. No, but you need to incentivize treating more people. You want to treat as many people as possible that need help. People need help out there, and they're not getting it because insurance is now the number one obstacle for you getting the treatment you need and affording it and getting it in a timely manner. Because you could go to these institutions that take other insurances, but your appointment's 4, 5, 6 months out. You're in tooth pain now. How are we going to fix that? We need to fix insurance companies. And I don't think they could be reformed. I think we need to create a new one. So that's one of my spiels right now. Koopa said sometimes I be kissing dudes. Oh, all right, Koopa. You do it. Make it good. Make them good. Lex said anything I can do to fix jaw locking due to impacted wisdom tooth. Now, generally, your impacted wisdom teeth don't cause lockjaw. Your lockjaw has to do with the anatomy of your TMJ, which is your temporal mandibular joint. Back here, you have one on either side. That's your lower jaw, where the joint fixes in. It's like the hinge of the joint, right? It's a type 3 lever, if you care. But impacted wisdom teeth are down here, right? They're near your teeth and up here, and that's not actually connected to them. Okay, so that's a great question, but they're not actually related to each other. They might both be causing pain. That's a different thing. But being associated with one another, not actually. That's actually a myth. Mike, how did your board exam go? Mike, thanks for answering. The board exam was actually pretty tough, especially since I was freezing without any hot water. And by the way, today I still don't have hot water. They ordered parts to fix it, and apparently all 5 parts were defective. How does that happen? Where are you ordering these parts from, and what kind of order did you put in that they all came in defective? That just baffles me. Now you have people, including myself, with the flu. I got the flu. I don't know if you hear it, but like I'm super congested. Now you got people on a couple floors of this building with no hot water. Today is day 36 without hot water. Got freezing cold water coming out at 25% pressure. You know what? Just pisses me off. So the board exam could have gone better. Could have gone worse, I'm sure, right? We'll see how the results come back in a few months. Yeah, it takes like a few months for those board results to come back. Jeez. Jalen Mitchell, how much would a strong post BACC performance increase your chances of getting into dental school? I don't know what the BACC is, but I'm assuming you're referring to like an entrance exam like the DAT. Yeah, a strong entrance exam is very important. Excuse me. The strong entrance exam is wow. That really makes my eyes red when I call for a sneeze. Yeah, get a strong DAT. All right. Ali Ode said, any advice for D1 who wants to do surgery? Yeah, the efficient and effective studying, what I mentioned before, that's super important because you want to make sure that you can manage all your exams adequately. Okay, I guess I'm not going to sneeze. Jesus. Yeah, so for D1 year, really focus on getting effective studying, like getting higher scores. And then working on getting efficient studying where you could maintain those high scores, 90s, 95s, whatever, A's by studying that subject less because then you can manage multiple subjects more. Okay, that's the key to D1 year. All right. OMFS Miami. Greetings from Miami, OMFS. What's up, guys? No way. You guys got a TikTok? That's so funny. Awesome. Well, good for you guys. You got to get a profile picture on there next. Say hello to my buddy down there. He's a 4 out of 4. He's about to graduate. Say hi to my Reed. Dylan said, yo, what's up, Dylan? Dylan said, that one dude who says orthogynic procedures are for MDs. You're referring to the last post I put up who just said orthognathic procedures are for MDs. I mean, MDs do orthognathic procedures, right? But generally, orthognathics are, yes, the aesthetics, the cosmetics, the facial dimensions, very important. But you have to remember the jaw is all about the occlusion. the functionality of the jaw. You mess up the way the teeth come together once, that could cause TMJ abnormalities, functional deformities. Like, so many issues can happen if you don't have teeth coming together correctly. Phonation, you might speak incorrectly if it doesn't come together correctly. So there's so much that goes into it. And the one thing I commented in that post is that, MDs that go to medical school, they have such a lack of learning of occlusion and what it means for the teeth to come together in a correct manner. So no, I'm not saying that they can't do it. All I'm saying is that I just want to know that they did have training on occlusion and how that the jaws come together around that, and then how they plan their surgery on that as well. KAG, but it's added to water. KAG said, do root canals correlate to cancers? No. I would ask the endodontist about that, see what they say. They'd be able to give more detailed information for me. But there was a very big misinformation Netflix episode that came out on root canals, a few years ago. And wow, I don't know what the heck that was about. I want to watch it, but it sounded like misinformation to me. Soupy Sack 1642 said, why do dentists still think that patients need prophylactic antibiotics? Well, it could be for different things. What if you have, you have endocarditis? What if you have recent joint surgery in your knee or shoulder or something that requires antibiotics prior to certain dental procedures? There's so much that goes into it, honestly. Ali Ode followed. Oh, thanks, Ali. Mike, cap means crown. Yeah, but you were saying wife cap lost, like your wife lost your crown. What about it? Vikram Bokinkir, OS is so interesting, but is it worth the training for what most OS end up doing? Extraction and implants. Yeah, but what about the complications that come with extractions and implants? You got to be able to manage that too, right? Do you want your patient to come back and say, look, I don't have an answer for this? Generally not. You know what I mean? Plus, the more you do surgically, the more you want to do surgically. And then what point do you say, oh, it's out of my scope, I need to refer you to an oral surgeon? I don't know. Are OS overtrained? In many areas they are, but in many areas the training involves all the complications that come from all the other specialties. It's kind of in certain ways it's important in oral surgery. In other ways, certain procedures that are just less frequently done. FirstDownDental said, Mike, if a crown keeps falling off without eating problematic foods, then definitely go back. FirstDownDental said cementing or prep might have an issue. Yep. Johnny gave a flower. Thanks, Johnny. Jose R7190, is it dissolving stitches day 2 was no pain, no blood? What is dissolving stitches? Wes Threet said, interviewing at my first dental school next week. Any tips? Yeah, just remember, an interview is a conversation. It's not a multiple choice exam. Don't overthink any questions. It's a conversation, and you want to find topics that you relate to with the interviewer. I tried to ask questions to my interviewer and just see what they like to do, what their hobbies are. Stuff like that outside of dentistry, actually. And yeah, that's my biggest thing. Luke said, I'll DM the school. Sure. Nina said, any tips for DAT 10 days away? Yeah, Nina, you should be studying right now. You should be hitting those index cards. You should be doing those practice questions. Bootcamp is a great DAT resource, by the way. That's one of the few things that I use. Marcy said, do you really need a medical clearance for patient on blood thinners? Well, it depends. What blood thinner is it? Is it Coumadin? Do they need an INR? If it's Eliquis, is it 0.5 milligrams? Is it 5 milligrams? Is it 10 milligrams? BID, TID? Like, you got to get to know, you got to know what's going on there. Next, once you find out what that medication is, maybe it's a good idea to ask what their PCP would like to do. Do they want to stop those blood thinners for that procedure? Do they not want to stop those blood thinners for a procedure? How many teeth are we removing, for example, if that's the procedure? Are we taking out 10 teeth? Okay, maybe we want to stop those blood thinners. Are we taking out 1 or 2 teeth? Then maybe we don't need to stop those blood thinners, okay? It's good to start that communication between the PCP and yourself if you're the dentist or surgeon, right? Just so you could be on the same page if something were to come up, a complication or extended course of bleeding or postoperatively, and so on and so forth. Mark McGuire said the stipend is $30K a year, huh? It's nice, but not enough. $30K a year while you're in dental school is unheard of. You're not going to find that anywhere else. I mean, I was making $60 to $80 a week lifeguarding on weekends during dental school, which was tough. I gave up my Sunday mornings. I didn't sleep in. I got my ass over there to work, and I could study while I was sitting by the pool. But essentially, it's really, what's, even if it was 80, but what's $80 a week? And, you can't make it every week. So say 50 weeks a year, $80 a week. That's like, it's not that much. You're making 30 grand. Don't even get into it with stipends. That's excellent. Marcy said, new doctor in the office and everyone needs a medical clearance. Yeah, well, it's good enough. I mean, that doctor should ask other doctors what what clearances do they find appropriate. We're always learning, and things change over time too. So that's important. Wes3 said, interviewing at my first dental school next weekend. Tips. Yep, I gave you that one. Sigma said, can we do bilateral IAN block? Can we do a bilateral inferior alveolar nerve block? That's what that means. Yeah, why can't we do bilateral nerve block? What do you mean? FirstDownDental says be confident. Yes, be confident. Be confident on your interview. So confident, kind of cliche. How do you present confidence? Here's something I would recommend. Get a playlist of all the songs that make you most happy, most enthusiastic, and most confident, okay? 3 songs in a confidence playlist. That's what now mine's like 20, 30 songs, maybe more. But start making a confidence playlist, right? Where you could literally hit shuffle and just keep going into that until you hit a song that's just going to get you in the zone for that interview, okay? That's going to be my tip for the interviews today, all right? Riley Q said, hi, I went in for a little pain and they said I have a amount of tooth bone decay. I'm not sure what you mean. Tooth bone decay? Odontitis? I don't know. I'm trying to figure out what you mean by that, Riley. CEO, how harmful is it to your OMFS application if you work for a year or two due to family reasons? If you worked for a year or two, that you have family reasons. I mean, if it came up, you're gonna have that in your application, right? It's gonna be probably in your personal statement, and you're gonna be talking about it on your interviews. I don't see any issues with that at all. User 3957. Any support for how to help TMJ? Is Botox a good option? Botox is one option. You have to understand though, is it myofascial pain? The musculature and the tissues of the face causing this pain and pressure in the area, or is it an actual deformity of the TMJ itself? Because Botox isn't going to help with that. Botox is going to be sometimes help to alleviate the myofascial pain, right? The musculature around it. Charles Dub 5. What is your opinion to fix these delusional, lazy hygienists asking for doctor income? Whoa. I'm not aware. I'm not aware of that. First of all, I don't know if that correlates. Everyone wants more money. Everyone needs more money. My biggest thing is, let's look at these insurance companies. They're not reimbursing much, and they haven't increased that reimbursement in like 20 plus years. In fact, some years they've gone down in reimbursement. So the sustainability of this career path is impossible at this rate. It needs to be fixed. And if it is fixed, I think everyone can make a lot more money and have a better living, better quality of life. And 1, 2, 3, more patients will get care, right? Because one of the number one challenges of patients getting care these days is the lack of insurance coverage. So, oh my God, I could go on and on and on. It's not about hygienists is what I'm saying, Charles. I think it's about something much bigger than that, of the entire healthcare system. And I think if we could identify and target that for a solution in dentistry and show it works, it's going to take a long time. It might take a couple decades, but change it, show that it works, figure out a way to make it work, and then put that into medicine. I think we'll be able to correct the system for the future in a good way. Ashley, hi. I was your patient 3 years ago. I had fallen down the stairs and fractured my jaw. Oh my goodness. What's up, friend? Are you serious? How about that? That's really interesting. And now we're on TikTok. That's really funny. Well, I hope you're feeling better, and I hope you're doing well. That's so crazy. 3 years ago. Yeah. That was residency. That was my first year of residency. Isn't that amazing? Well, Ashley, good to see you, friend. Alexia Gomez V said, can you become a plastic surgeon if you do the... Sorry, Alexia Gomez said, can you become a plastic surgeon if you do the DDS-MD route? Yes, technically you can go on to plastic surgery. I don't know if you'd have to do some fellowship training in plastic surgery specifically in order to get to that point. Yeah, it is possible. Soupy Sack 16 who said 2015 ADA guidelines recommend against prophylactic antibiotics for all patients with prosthetic joints. Okay, yep, but what does that provider who's prescribing prophylactic antibiotics want for that patient, right? Because it might not be up to you. If it's their joint, it's their liability as well, just as much as it is yours. And they will dump that on your plate if it comes to court. So that's something that I would think about regardless of ADA guidelines. All right? That's serious. Okay, let's get to the next. Excuse me. Again, I got the flu right now. I was out today, went on a couple days ago. Scam for sure said, can I irrigate my wisdom tooth sockets 5 days after extraction? Gently, you can start to do it. I would make sure that the blood clots I might even wait a week before starting to do that. 5 days, you're generally getting there. I would probably wait a week before you irrigate the socket specifically. At 5 days out, you can start brushing your other teeth though, however, okay? CEO, CEO asked, how harmful is it to your OMFS application if you work for 2 years? Yeah, I mentioned that. Donnie said, do you allow shadowing at your office? I'm not in an office yet. In 5 or 6 months, August 15th, 2025, I'll be starting at All County Oral Surgery Office in Melville. So I'll be out there. And yes, I will allow shadowing. at my office. I have Freon said, how any clean doctor jokes? No, do you know any clean doctor jokes? Besides the, like what time is your dentist appointment? 2:30, like your tooth is hurty. That's the only stupid clean. I'm sure you've heard that like a million times. I know a lot of dirty doctor jokes though. I got a really funny dirty dentist joke. Alexia Gomez said, "Can you become a plastic surgeon if you do the DDS?" Yes, I'm answering that. Mother T said, "My chemo and DZ is killing my teeth. All the dentists are saying no to dentures and implants." To dentures or dentures and implants? Because dentures and implants, it might take some time for you to be able to get implants if you can. But dentures, I don't see why you can't get dentures. I don't know your whole situation going on, but just regular dentures, I don't see any issues with that. EGM, what is the difference between DDS and DMD? Applying for dental school soon? You're a huge inspiration. Oh, thanks, man. Thanks, man. Yeah, the difference between DDS and DMD is really nothing, okay? The difference is that it was like Harvard and the switched off the DDS track and created the DMD. And then a couple different institutions followed that course, like UPenn, and then other dental schools had changed that course, but then many just kept it as DDS. As far as what the degree is, there's no difference in what you can or can't do as a dentist. Julius Mendoza said, "What are your research interests? Do you plan on conducting your own research in the future?" My research interests are unconventional. They're not the typical clean-cut research that everyone's doing. My research would I'd like to honestly do this if you're interested in doing it. I'd like to use AI to look at what different reimbursement, dental treatment, like procedure, reimbursement rates are per different areas in the United States. That's what I look at. I like to get it down to each zip code. I'd like to see what insurances are accepted, what aren't. I'd like to look at research and which dental insurances have increased reimbursement for treatments that have already been rendered over the last 20 to 30, 40, 50 years, since the beginning, 50 years ago or more. I'd like to look at the average percentage of each dental insurance company of what's accepted versus what's denied, what specific treatments are accepted and denied, and why. This is what I would like to know, because my overall goal in my career, I'd like to help a number of patients, as an oral surgeon. I'd also like to see how it can make dentistry better. And right now, I think the root cause of a lot of problems in healthcare right now are due to insurance and lack of coverage or lack of reimbursement. And so my goal is to create a better insurance company right now. That's it. The next 10 years, I want to create a better dental insurance company. And that's one of my primary focuses, to make this world a little better place. Okay. That's the truth. So research, I want to see how we can make dentistry better by creating a new insurance company. And that's going to involve research on what the current systemic problems are in insurance of dentistry. Mark McGuire, boot camp got me at 24. That's an excellent mark. 24. Excellent score, man. Well done. Well done. Q said, my calprotectin came back high. What does that mean? I'm not familiar with calprotectin. I'm not familiar with that lab value. But if you let me know what it is, maybe there's another doctor on the chat right now who can give some insight. Any followed the live creator. Thanks, Danny. Mark McGuire said, true on the stipend. I'm grateful. Yeah, dude. Nerm followed the live creator. Thanks, Nerm. Sigma said, exo of hypertensive patient without consultation or consult and delay patient where patient has severe pain. What would you do an extraction on a hypertensive patient without a consult? No, like, well, what's the hypertensive, like, what's the blood pressure on this patient, like, consistently? That would be my next question. What other medical history do they have? I would want to know all these things before I give any answer to that. Makiba said, how often do you have to replace crown after root canal? I'm not sure. I don't do general dentistry. I haven't done it for 3.5 years. I'm not sure. CEO said, any hard recommendations on what you studied with for the CBSE, Anki, B&B, UWorld? Yeah, that's a great question. I would, if you can, I would look at the YouTube video that I put out with Brandon Axelrod. We went over the updated, as of this year, what our best recommendations are for Axe crushed the CBSE. And we went over what I did. And I kind of like mentored him through taking it. He took it, crushed it. Then we kind of compared what the methods were. I would listen to that. It's called CBSE Dissection. If you follow that video to the T, you will get the best possible score that you can get on that exam. Not the best possible score of the exam. You will get your best possible score that you can get on the exam. Trust me, follow that to the T every time you take that exam, okay? That's my recommendation. Mango Kyle followed the live creator. Thanks, Mango Kyle. CEO said, last question for you. Appreciate all the fantastic feedback. What CBSE score would you suggest? Well, get the best one that you could get. Maybe aim for 70, 75. If you don't get that, that doesn't mean you can't apply to oral surgery residency, but take your time and really study for that thing. Take it as many times as you can. You get 6 tries. You can only take it 6 times throughout dental school, so it's plenty of time, and study hard for that. CEO said for a Canadian applicant that has completed GPR working as a GP and is studying for the CBSE. Yeah, but that's what I would recommend you do for it. Sigma said, can we put alveo gel immediately after extraction for all patients? That sounds like a trick question. Also, alveolar gel, you're talking about like a collar plug? Are you talking about like Surgicel? I'm not familiar with alveolar gel. I haven't used that. Caroline, what is the call like during the various years of residency? Do you sleep in the hospital? Yeah. I had to sleep many times in the hospital my first and second year. Third year, yeah, then that's if you get time to sleep while you're on a call shift. Many times you don't get. And yeah, no, I did actually sleep my third year as well. This fourth year, I haven't slept in the hospital. I really, God, don't want to. I also have an apartment that's right across the street from the hospital. So why would I sleep in the hospital unless I absolutely have to, which I did on many rotations. Yeah, call the first year was like Q3, Q4 for about a year, actually. Yeah. I did my first 6 months on anesthesia, and then after that, it was like Q3, Q4 call. Only one weekend off a month for over a year, actually. It was over a year. It was 13 months that I had to do that. Yeah. Wow, that sucked. And then my second year, then it became like Q3 to 5. My end of my second year. Third year was like, it was like call once a week, 5 times a month, and 2 weekends off. My third year was 2 weekends off. And then this year it's been like two to 3 weekends off a month for my chief year. But second call every night that I'm on these 2 rotations, that's 4 month stretch. So second call every night, on call 2 times a month. And then right now I'm in a 2 month stretch. I'm only on call once a month and no second call at night. So all right, guys, my throat's really starting to lock up from because I got the flu right now. You can hear my voice changing. Mother T saying no to dentures, DZ disease. Sorry, school saying no to dentures, disease. Yeah, dude, I don't understand why they're saying no to dentures. Implant supported dentures are different, but dentures, again, that's different. So I don't see why not. I don't know your exact situation either. Aaron MCC VIP said, "Do you have any recommendations for someone who needs a full dental restoration? The money? Oh, for the money." For the money, I don't know what I could tell you as far as the money goes. For things though, I save until I can do it. Riley Q said, "Are wisdom teeth required to be extracted?" No, wisdom teeth are not required to get extracted. It really depends on a variety of things, between symptoms, between pathology, between pericoronitis issues or possibilities of it occurring in the future, stuff like that. Like 30 to 50% or something like that. It's like some crazy number after 50, 55, impacted wisdom teeth can develop cysts. So that's something where we tend to kick that can down the road, but that actually is a serious issue that needs to be considered at a younger age when wisdom teeth are like easy to get to, the roots aren't fully formed yet, they're not near the nerve. That's when risks of any injury or issues are at the least, right? Excuse me. Adam said, "Do you recommend the DMD PhD program? I'm very interested in research and want to teach in the future." Wow, that sounds like if you can get into the DMD PhD program, and you're interested in research and teaching, yeah, I mean, that sounds like a home run for that route, right? You're not sure if the pay will be good, even though you'll be debt-free coming out of the DMD PhD program. Well, the pay, especially in healthcare, the trajectory that it's going in, I know that it seems like very high salaries, but the fact is, a lot of dentists and doctors, they're not even in the top 1% anymore. Some dentists and doctors aren't even in the top 5% anymore. And which is an interesting thing. You shouldn't go into a profession that treats patients solely for like salary numbers or like to make a lot of money, but you should be able to live comfortably being that you're trying to help people, right? And I think, God forbid it comes down to it, you probably want the utmost maximum focus of your doctor that works on you. The less that doctors get reimbursed, sure, there's always that small percentage of like doctors and dentists that are greedy, but the majority of us go into this profession for the seriousness of patient care and the utmost focused on making the patient's daily life better and better, right? That's a fact, okay? I can tell you that. Now, moving on, what I would say is when it comes down to it and you have a serious issue, I think you want your doctor or dentist or surgeon to have the utmost focus on fixing that and making sure it doesn't come back, right? God forbid you get cancer or something. You want that gone and to not come back. You want them to be utmost focused on there. The less reimbursement that each doctor gets from insurance companies, for example, or in other ways, the more patients they have to see to make the same quality of living, to maybe pay back those loans, to finally buy their house at 50 years old or whatever it may be, to finally have kids, right? And now that's not associated with patient care, right? But the quality of life is required. The more people you want that doctor to have on their schedule, the more patients you want that doctor to see, because for each procedure or for each appointment, for each whatever becomes less and less, the more they have to pump into their schedule. And what I'm saying is that minimizes their focus per each patient, unfortunately. It's just a numbers game. Some doctors are seeing 10, 20 times what was the amount of patients we're seeing in a day 30, 40, 50 years ago. Where are we going to be in another 30, 40, 50 years? In this direction, it's just not going to add up, right? And now we're going to rely on technology, AI, to just run people through the mill. And I disagree with that model. That's where we're going right now. I think we should be slowing this down, allowing doctors to have a good quality of living, allowing them to maximize their focus per patient. And that's just not the direction we're going in. And I disagree with it. So, I'm going to stick up for that throughout my career and as I advocate for different professions in the healthcare space. But we're really going to need to stick up for that as a whole. And we're going to need to create solutions that can actually mitigate the problems that are occurring right now and show a course for how it can be better for the future. Okay. A couple more questions and then I got to go, guys. I got to go eat and get some stuff done. Makiba said, longest surgery you've done? Yeah, probably around 12 hours, probably around 10, 12 hours or so. There was a coronal flap that I was observing. I assisted a little bit at VCU when I was an extern. Since then, a bit shorter. Yeah, for like 8 to 10 hours. Yeah. Favorite cologne from pre-rock. My favorite cologne. This is a little embarrassing. Since like my grandmother got me it in literally like 5th or 6th grade, I've worn the Jake cologne from Hollister. It's pretty embarrassing, right? But I did like, the problem is that the cologne I don't know if it's cheaper now. It smelled so much better back then. I still have like the original vial. It's like at my my childhood house in like one of my cabinets, and I try it every once in a while, and it smells so much better than the current one. So I don't know. I need to find a new cologne. That's what I'm getting to. Tyrese loves cats. Any concern for the future of OMFS? Well, yeah, I don't know what the concern is. My concern is that there were 21 unmatched spots this year into oral surgery. 20 of them were 6-year, the MD ones. 2 of them were technically 5 at Case Western, and only 1 unmatched spot at a 4-year, which was Harlem Hospital. 21 unmatched spots is a lot of a specialty that has like between 250 and 350 spots. 21 is a lot. And last year was 26. The year before that, 2023, was 12 unmatched spots. These are a lot of unmatched spots, and that is not good. We need to talk about this more, and we need to adjust this specialty for better, because this is not working, obviously, if this is going to continue, All right, friend. Live will end in 4 minutes. Activity during the live, complete verification, doing your... Dude, what? I literally just got like spammed an advertisement with a thing due to inactivity on the live. We're talking. I'm scrolling every 30 seconds. Wow, TikTokers really suck sometimes with their like AI detection and bots. Tyrese Lovecat said, are there any bad OMFS programs per se? There are. Unfortunately, there are. Camden Ray said, doctor, I really need to get help. I injured my mouth while Listerine. Now I have mouthful of canker sores. I would go visit your dentist. Go visit your dentist. Maybe see an oral medicine, oral pain, oral pathology specialist. Hashim Khan, follow the live creator. Thank you. Aaron McVIP, follow. Thanks, guys. Let's see. Makiba, when do you not recommend removing wisdom teeth? So the classic thing is, say all your wisdom teeth are actually grown in and you have plenty of space in your mouth. And third, you're able to adequately clean them properly. I'm not so sure now I don't know every situation, right? But just generally, if you meet those 3 requirements, you're able to clean them properly. They're not causing any periodontitis behind your second molar. They're fully in your mouth. You have plenty of space, right? I don't understand why you would need to remove your wisdom teeth at that point. You see what I'm saying? All right, friends. I got to go, and I'm going to wrap it up. 7:03. All right, friends. Yeah, this is it. There were more questions. I love you guys. The top 3 listeners who listen to the longest of the live chat, I'm going to be giving you guys a shout out in the caption on when I post this on YouTube and podcasts, right? Thanks for coming out. This is TikTok Live number 46. TikTok Live is on. It wasn't bad. Let's go, guys. All right, friends. And I hope you guys all have a great 2025. It's been a crazy year so far. I still don't have hot water. Today's day 36. They said it's going to be another week at least. God, you never know what to expect. Yeah, I didn't know I was going to have 3 weeks of straight cold water leading up to my oral maxillofacial surgery boards exam. But yeah, you can never expect. Well, like there are worse things in the world. I know. But all I'm saying is keep a good attitude, keep after it, and you never know what could come up, but conquer it, okay? Beat those things, all right? And don't get distracted by the little things. All right, friends, have a great week.